Good afternoon again. Let me start off by saying last night, protest across the state was very peaceful. And I want to thank all the local law enforcement officers for their efforts to protect Missourians and maintain law and order. I also want to thank all the protesters for honoring the curfews and going home after dark, and everyone I met in St. Louis yesterday, the clergy, the Urban League, and the activists for their leadership in supporting a peaceful evening. Again, I very much support peaceful, nonviolent protest, and we are committed to protecting that right for all citizens. If we are to truly make a difference in our society, it is going to take all of us listening to one another, working together for a greater cause, and standing by each other in peace and unity. I know there have been a lot of questions regarding the National Guard's role, so I want to clarify that from yesterday. We currently have over 1,000 guardsmen deployed across Missouri. The Guard is mobile and can be utilized as necessary in support of local law enforcement agencies in roles such as site security, for example. The Missouri State Highway Patrol and the National Guard will continue to support local law enforcement with law enforcement efforts. The Guard's presence means more law enforcement officers are available to respond to protest and any potential criminal activities. Today, we traveled to Columbia to meet with the mayor, the county commission, the chief of police, members of the clergy, education leaders, and local legislators to discuss COVID-19 testing, the economy, the budget, and the civil unrest. Meeting with these people, we need to be able to find solutions early and going into the communities. I think it's important for me to be out. Tomorrow we'll be on the road again to different areas of the state to be able to talk to the local leaders and really see what's going on in their communities and how we can help. I think it's important as we go through this process. Many of the things I just read off to you are short-term things that we're dealing with. You know, civil unrest, the budget, COVID-19, but we also have to be thinking what's the end game to all of these at the same time, and how do we handle the next issue that comes up in the state of Missouri, and what are we going to do in the future to change the system? And I think that's why it's important to have these meetings. It's why it's important to meet with the African American community right now and try to not only say, yes, we know there's a problem, but what are we going to do for the end game? What are we going to do to try to change things in this state? And I think it's important to start that process now as you work through all the other things that we're working with in the state of Missouri. A couple of weeks ago, I announced our plan to rapidly increase COVID-19 testing in Missouri. As Dr. Williams mentioned yesterday, Missouri reached a record of 11,000 tests done in one day last week, and we averaged over 8,000 tests per day on that. I might want to add, if you'll just remember about 80 days ago when we just started this, a week into it, we were scrambling to do 100 tests. And today, so I think it's important to realize how much changes have been made in this state, and frankly, nationally, how many more tests we can do and how more available that's going to be. Again, I will stress and keep stressing that testing is so important for the future of our state, to get the economy back, to get people back to work, to get the businesses open. It will all rely on testing. To get our schools, get our school kids back out there, to be active, to get our churches going, it will depend on the testing across the state of Missouri. This is a huge increase where we first began to ramp up our testing efforts and well exceeded our goal of 7,500 tests per day. So far this week, we have again exceeded our daily target of all three testing strategies. The box-in testing, our goal Monday was 700 tests, and we actually did 1,298 were done. The sentinel testing, our goal on Monday was to do 210 tests, and 344 tests were completed. We have also had a great turnout for community testing. Over 1,100 tests were done in both Monday and Tuesday. We have already completed community testing in St. Charles, Jackson, and Boone counties. Testing is wrapping up in Jefferson County today, and we will be taking place in Greene County and Cape Girardeau the rest of the week. As our testing volumes increase, we've seen our positivity rate decrease. Our cumulative positive rate is approximately 6.5. And if you know, earlier on we was around 10%, that number. So that number is going down. Again, I want to stress to everyone, sometimes we get infixed with the number of how many positive tests that have tested. It's about the percentage that you want to know, and it's about the hospitalization that goes along with that. Additionally, hospitalization has dropped by over 40% statewide the past month. And that is very good news for all of us. Our hospitals are not overwhelmed. Our positivity rate continues to decline. People are recovering, and we are moving forward. Even as Missouri recovers and moves forward with COVID-19 testing, will continue to be our priority. The more testing we do, the more data and knowledge we have on the situation in Missouri, and the more confidence and reassurance we can give Missourians as we work through the recovery process. Tomorrow, Director Dixon will be here to talk more about the economy and the recovery of the economy and things we're going to be doing to get that going. In the meantime, I want to continue reminding everyone to please be safe, look out for one another, support each other. These are tough times for our state and our nation, but we will get through this together. I want to thank all of you, and God bless for everyone that's listening. Dr. Williams is also here to answer some questions on the COVID-19. He may have a little bit of an update for you, but Kelly, let's go to questions first while I'm here, and then we'll go to Dr. Williams.
Questions for Governor Parson. Jack?
Hi, Governor. You received a letter from the St. Louis Police Officers Association criticizing Chief Hayden. So do you have faith in Chief Hayden, and do you have any plans to, are you considering vesting situational control with someone else?
Right now, I do know my officer received that letter you're referring to, I believe, yesterday. I know there was several requests in that. One was for the National Guard, for the Highway Patrol to assist. We have done all of those in that request. As far as Chief Hayden goes, I met with him yesterday. It was the first I knew about it last night. Not sure of all the details that go along with that right now, but I think one thing you got to take in mind, if you replace a chief or if you find an alternative way to do that, who takes that over and who would be in charge of that situation if that would occur. I think it's simple to say, with everything else going on, the Highway Patrol, I think one of it mentioned in there about the Colonel of the Highway Patrol, more than likely that would not happen. We don't have the support to take over a police department the size of St. Louis when we have the entire state to work on. So I'm aware of the letter, aware of the situation, but no action on my part as we speak today. I just haven't had time to do that. I've just not been personally been contacted about that issue until I got that letter yesterday.
And you said yesterday that that you were calling up over 1,000 troops. You said that they were on standby. Did they take any actions last night?
Yeah, they did. When I say they're on standby, they're boots on the ground. They've been utilized ever since Saturday night. I think the first time they were utilized was in Kansas City. They were in St. Louis Sunday, Monday, last night on the ground, different places, assignments they had. And probably General Compton, he'll be back here in a few days, and you can ask that on the details. But they're actively out there doing things every night. Not all of them, but whatever those assignments are.
And to clarify the first question, just real quickly, so do you have faith in the St. Louis Police Chief, and you don't plan to vest situational command with anyone else?
Yeah, all I'm telling you is I just received a letter yesterday. That's what I have. I haven't made no decisions, haven't made no opinion on that yet, other than I received that letter. But there's 1,000 other things going on right now.
With the percentage of Missourians testing positive for COVID-19 lowering, are you considering moving up the second phase of reopening?
Not right now. We're on June the 15th where we're at on that. We're going to kind of look at everything every day. We got a lot of things going on right now in the state of Missouri. You've got the COVID-19 we're dealing with every day. Summer's starting to open back up. Different activities are going. More people are out. That's why we're increasing the testing. You've got the protests going on out there. There's risk involved in that. We just need to see where we're at here for a little bit.
And has Missouri deployed any of its National Guard troops to Washington, D.C., as some other states have done?
We have been requesting, we will be sending some of the troops to Washington, D.C. I think we'll be doing that probably in the next day or so. We'll be sending out there to support that. Let me just make a comment about that when you asked me that. And this is kind of coming from the veteran side of me. You know, all of our jobs, no matter what state you're in, no matter who the president is, protecting Washington, D.C., protecting the monuments, protecting our history of who we are is important and should be important to every citizen. And politics out the window for a side, we got to maintain that law and order. So, yeah, we're more than willing to help to preserve that.
Hi, Governor. Just another clarification on the Guards' role. Do they have the power to make arrests or use any other level of force?
Yeah, they could. They could. The goal, the way the Guard is set up, is they're set up aligned with the Highway Patrol. So, you know, they're kind of, I don't want to say they're quote under the umbrella of the Highway Patrol. I want to make it pretty clear they're working together. So we're using, for example, I'll give you, in one of the cities, the highway or the Guard would be guarding the infrastructure facilities there, like a police station, for example. They'd be guarding that. That frees up officers to go to on the front line to be able to handle the criminal side of it. We don't really want to put the Guard out in the place where they're doing the upfront policing side of it to be able to do that. I think you got to be careful when you use them for that function on that. But legally, they could go out there and make arrests if they need to make arrests during these times.
And so you called up 1,000 more troops. How many in total are involved at this point?
You know, I'd rather the general give you that information, but I'm going to say probably in the next day or so, we could easily have probably 1,500 to 2,000. That's probably, in the process, I want to say being called up or activated. There's a little bit of difference between there when you ask about boots on the ground versus what's being activated. But I'd say somewhere between 1,500 and 2,000 will be activated in the next several days.
Okay, thank you.
And that'll be a total number than what I'm telling you for right now.
Hi, Governor. With more news coming out from Minneapolis today, just kind of talking about the charges and stuff, is the state of Missouri prepping for any more larger demonstrations, protests across the state in response to this new news? Do you expect any?
Yeah, you know what? We're preparing every day. I think just like being in Columbia today, being in St. Louis yesterday, that's exactly what we're doing. We're trying to make sure that there's a plan moving forward. I can't emphasize enough how important it is to make a plan in place for legal protesters and to separate those from the criminals that are out there committing crime. And I think we're preparing for that every day, trying to make sure the public knows that, trying to make sure what role I'm playing as governor. You know, again, I think it's important. A lot of questions on the National Guard, but we don't want that to be perceived like we're going to be out there putting the National Guard up front doing a military maneuver of some kind. They're really there as in a support role and to help local law enforcement is what we're doing. So every day goes by that we can promote that and ask people to protest peacefully, maybe help us to know when it's over, and when they say it's over, go over, and then whoever's left, you know, we can deal with that situation.
Hi, Governor. Data compiled by the U.S. Police Shooting Database, as well as a couple other organizations, lists St. Louis as the worst city in the country for police violence per capita. Do you have a plan to address this to make the community safer for police and citizens?
I have no idea what you're talking about on the reports. I haven't seen anything like that. Don't know where you're getting that from or where it is.
I wanted to ask you yesterday, but I didn't get the chance. Would you accept the use of the U.S. military as President Trump has suggested?
No, not at this point. We don't need to use the U.S. military at this point, not as long as I got the National Guard. First of all, it's not my call to make on the U.S. military. That is the president's call to make. Mine is the National Guard falls under my umbrella, and that's who's under mine. So that's who I'd utilize. You know, we got, you know, look, I'm confident in the law enforcement in this state, all across this state, whether it's a sheriff's office or whether it's a police station, and my National Guard. I got the utmost confidence in the Director of Public Safety, the Colonel of the Highway Patrol, and the General of the National Guard. And I will let them do their jobs, and I'm confident they can get the job done.
All right, thank you, Governor.
All right, thank you. Dr. Williams?
Thank you, Governor. I want to say one thing right off the bat. I talk with the physicians in Missouri, my fellow physicians, every Saturday, and right before I came over here, the pediatricians asked me once again to enlist you in their help, that we just think it's so incredibly important that because Missourians have done so well in getting us to where we are, where we're 4 weeks into our recovery, and our hospitalizations are down and our positivity is down. But they asked me just to pass on to you. It's just really important. They've been there for everybody, but this would be a great time to quit deferring your wellness care. You know, so if it's time for you to have a preventative exam or you're putting off something, their request to you as the media, and they asked me to pass on to you, was just to stress the importance. You know, the governor and I think prevention is really important, and it's very understandable if people have put that off for 3 months. But we think one of the benefits of working so hard as a state to where we've gotten to is that we now can have the benefit of getting back into preventative care and going to the physician and not putting things off. So just very much on their behalf, they asked me to share that with you, and thank you for letting me do that.
Dr. Williams, as people have returned to their normal way of life, yet you say the hospitalizations are down. To what do you attribute the decline in the hospitalizations?
Yeah, you know, it's always a lagging indicator, and I know it's one the governor has really emphasized because, you know, testing can vary, that kind of thing, but hospitalizations are really, really important. And we think that it goes back that we know that, you know, the average age for COVID-19 in Missouri is 55. The average age of death is 77. Much of our morbidity has come out of nursing homes. And so as you decrease those new cases on the front end, and we think testing helps us do that, then you decrease the number of people, especially our elderly, who get sick and end up in the hospital. So it's very much trying to get ahead of it at the front end to keep 77-year-olds from getting the disease and ending up on a ventilator for 3 weeks with the very serious morbidity and mortality. So I attribute it to prevention. I attribute it to getting ahead of this, and that a month into this, we are not seeing a reemergence of widespread community transmission, which we're incredibly thankful for here in Missouri.
Hi, Dr. Williams.
Hey, Philip.
Wuhan in China today announced that over the past 19 days, they've tested something like 10 million people out of 11 million in the city. Is any testing campaign proportionate of that kind of scale something that we would like to work toward here in Missouri, or is that even possible? It's
a good question, and I appreciate you bringing that up because, you know, as we've learned here, testing is incredibly dynamic. It changes almost weekly. So today we're putting out a health update that for antigen testing, which people have promoted as being able to do millions of tests. You know, the nasal swab where you check the antigen, it's a point-of-care test, you get it back immediately. But as we investigate that, you know, we're going to have to see if that truly holds the promise it does. There's, again, the issue with cartridges, and there's going to be the issue that you have to kind of back that up. So I think to get to the scale you're talking about will probably involve technological advancement as far as at-home tests, easy point-of-care tests, those. But as the governor said, you know, we now have the capacity to do 11,000 tests a day in Missouri through 20 labs. And if you look at where we are now, where we were 7 weeks ago, I just get up every day incredibly thankful that we can test a lot of people. Now, again, to your point, I think that we'll have to get even better at that, and that new technology will probably help us come September or October.
And to the point you just made about pediatricians urging parents to get their kids their routine exams, do you have any numbers on how many families have deferred those kind of exams?
I do not. I think I just know anecdotally, the governor and I talked to different physicians, and whether it's the Missouri Hospital Association or the infectious disease doctors, or I talk to the physicians on Saturday morning, it's a constant refrain that we hear is that we really have seen our number of inpatient and visits diminish for other things, and it just gives us great concern that whether it's heart disease or diabetes or these other comorbidities which affect COVID-19, that we'd like to use our well-earned gains from the people of Missouri helping us tremendously to prevent other morbidity and mortality that's not usually associated with COVID-19, like diabetes and heart disease, or getting your vaccines, or getting your mammogram, or those other issues.
Thank you.
Thank y'all. I'm sorry.
Sorry.
okay.
I know this was recently asked. I can't remember which day. Our days kind of blur together at this point.
They
But
do.
has there been any additional positive cases resulted in the Memorial Day weekend celebrations at the Lake of the Ozarks in Missouri or other states?
Yeah, thank you so much for asking me that, because when you ask me a question and I don't know the answer, I always do try to follow up. And the answer, to our knowledge, is no. I talked to B down in Camden, and they did the case contacts from the patient. And so Camden County, which was the number one county, has not seen any more contacts, or any more positives. And that's now been a good while ago, 10 days, 11 days. So thank you for asking me that follow-up. Thank y'all.
All right, thanks for everybody for being here today. We'll be back tomorrow, and then I think we're back on the road Friday again, I believe. So thanks everybody for being here today. Appreciate it.